Some advice from Dr. Daniel Israel. He's also part of the Gauteng General Practitioners Collaboration. Doc, thanks so much for joining us. So we're over the fourth wave. It seems there's all sorts of other bugs making their presence felt. You speak to GPs all the time. Just how busy are they at the moment?
Thanks for having me. So GPs seem to be a bit busier than they would normally be in January. January is often the quieter time in the year. And that may sound to most of us like something to be a little bit wary of, but I actually think that might be a good sign in this pandemic, because we must remember that in the COVID bubble that we had before, COVID was the predominant infection and that people weren't going out and about. And now that there is some return to normality, we are certainly seeing what we would normally see, but even more at the moment.
All right, so you'd say that it's a bit of a bounce back, that all the other bugs that we've been sanitizing and masking away, now that we're a little more relaxed and we're socializing more, they're just coming back.
Absolutely, and we certainly see that in summertime often there's a lot of gastro that goes around, and we're quite used to it in Gauteng, for example, but we are seeing it, as I said, more than usual, and it's, yeah, perhaps people aren't as used to being around others as before. What really is interesting, though, is how you tell the difference between all of these things, because there's a huge overlap in a new environment.
Exactly. I mean, before with the other variants, it was less of a sinus and it was more of a lung issue, and you watched the lungs. How do you distinguish between a sinus infection, a strep throat, even a tummy bug, which we know can be a feature of Omicron? How do you tell the difference?
So particularly from the patient's perspective, when you're infected with a sore throat and a running stomach, and do you presume that you have COVID or do you not? So I think the most important thing as you rightly said, there's a big overlap, Sally, and no one could say just at first description that's definitely COVID or it's definitely a bug. But I think the important thing at the beginning is to make sure that you're doing the socially correct or socially responsible things. So if you have some of these symptoms, and we know in COVID that the symptoms are sore throat, congestion, upset tummy, aching body, fever, etc. If you have some of those, you should really protect other people, and that's in this environment time to stay home and be safe. Then, there isn't a certain symptom that's indicative of Omicron, but by seeing your doctor, the doctor often will choose to test, because if you test in those cases, you're able to contain the spread of COVID, which is still happening more. If you choose not to test, then you just make sure that you are not exposing other people, who might be at risk.
Because that was what I was going to ask. Does it matter if it's Omicron? We know that something like 90% of the population has had some sort of infection or vaccination to create an immunity. Does it matter if we figure out if it's Omicron or not? Or is it still important to test and identify these cases?
So we're not at the stage in the pandemic yet where we're ready to let the cases run wild, because we must remember that of the deaths of COVID in South Africa, I saw a stat of about 10% are actually from Omicron. So we're not getting a no morbidity and mortality rate in Omicron. And if, considering its infectiousness, if you put that across a whole population, you're going to get quite a few people who don't come out very well if they just let Omicron go wild. So it's important to test where it's going to make a difference. I would say that if you're a young, healthy person and you have symptoms that are not necessarily Omicron and you aren't coming into contact with anyone who's at risk, then you could just presume it's a viral infection and treat the symptoms, because as we know and we've proven, there is no special treatment for COVID in the viremic phase.
All right. Here's the other confusion. In December, the Department of Health issued a release saying that basically track and tracing was done and dusted, didn't have to do it anymore, you didn't have to isolate. I can't even remember the details, but basically all the bets were off, everything was fairly much lifted. Then a day later, they said, no, hang on a minute, everything's back as it was. The department has told me that they were going to issue a new set of directives just to clarify what the rules are now. We haven't seen that as yet. What exactly are the rules around when to test, how long to isolate, how long, if you've been in direct contact with someone who's got COVID, should you stay at home? All those questions. What are the rules? Do we know?
So the rules are as they were before. There's a 10-day quarantine period. If you come into contact with someone who has COVID and if it's a considered exposure, it's 10 days at home, even if you have no symptoms.
Even if
you've been vaccinated.
Even
if you're vaccinated. And the other rule is that if you get COVID, you need to stay at home or isolated for 10 days from when you get COVID. But the point here, and this was made from the MAC, which is the Medical Advisory Committee to Government, is that, as you rightly said, when there's been such a spread of COVID already in the community and when the cases are so rough, the point of contact tracing, we call it, when you look for people who could have been in contact with other people and keep them isolated, loses its relevance because it's already out there. And one could argue, and we've seen all these good arguments, that keeping people at home has, in those cases, has much more of a negative impact on society from an economic, social, emotional, etc. perspective than not. So we were really as doctors, we're really looking forward to, and it was very good to see the government taking the MAC's recommendations and taking away quarantine. So they took away quarantine and they reduced the isolation period for people who have COVID. We don't know exactly what went on behind with that. It is reverted to the original laws, but we are really awaiting an imminent announcement from government that hopefully those will be relaxed so we can function better. But in the meantime, we have to have a conformity and we have to do and that is the original guidelines.
All right, so the advice that you are giving to patients is if you are in and have been in direct contact with someone who's got COVID, they should be staying at home for 10 days.
Absolutely, and we hope for that to change soon because we have seen that COVID is more infectious at the beginning. But I think it's important for people out there to understand that until we've made that a policy, and COVID is a public health problem, and we have to have a public health solution to COVID. So when we, as a united whole, have a certain approach, we must follow it through consistently. So I do see that changing very soon. But at the moment, it's back to the originals, and we have to keep that for now.
All right. Well, I think we have to chase the health department for our program tomorrow. Dr. Daniel Israel, thank you so much for chatting to us. He's a GP with the Gauteng General Practitioners Collaboration, telling us, yes, there are a lot of flu and cold bugs doing the rounds. A lot of that is because we're relaxing a little bit more as we're out of the fourth wave.